People with a complex array of medical, behavioral health, and social needs often receive health and social services that are uncoordinated and inefficient, providing little lasting value to the patient. There's growing interest in figuring out how to better care for this relatively small yet diverse group of people. But it can be difficult to find evidence-based and promising approaches to care that meaningfully improve health outcomes and reduce avoidable costs for this population.
How to get to quality, how to meet the needs of patients in a high-risk and vulnerable population. There's just not a lot. There's just not a lot out there.
The resources that practitioners need can be from so many different sources that having a one-stop shop is critical to make an efficient delivery and an efficient uptake of these resources so that people can put them into practice right away.
I think one of the most interesting challenges is just how much innovation is happening in the field and how much is not published. And then also the challenges of getting published for people who are outside of the traditional academic system.
The Better Care Playbook is an online resource center dedicated to helping busy, complex care stakeholders like yourself find information about what works to improve care for people with complex needs. It is made possible by 7 leading healthcare foundations that are working together to accelerate health system transformation.
The idea behind the playbook was, how do we create this single repository of the best evidence, the best promising practices, so that those in the complex care field can go to one place and learn really what's top of line on providing care delivery to these complex populations.
I think one of the biggest challenges in working in a safety net or working in the the public sphere is that it can just feel really isolating. You can feel like you're on your own. But if you get onto a resource like the Better Care Playbook, you can all of a sudden see all these other ideas of, oh, they get it. They know what we're going through. And they tried this. And it didn't just work for one person. It actually worked at the system level.
Whenever I'm working on a new initiative, I always look to see what's new, what's there, what tools are existing to save me time. I love hearing from my peers who are publishing in the playbook and seeing, what's the latest with their work.
The playbook curates the latest peer-reviewed articles, reports, implementation tools, and case studies on a wide range of topics that are relevant to complex care stakeholders, such as interdisciplinary care teams, health-related social needs, and serious illness and palliative care. The playbook also highlights perspectives from thought leaders and on-the-ground workers in the complex care community through blog posts and webinars, and welcomes user-submitted content from the field, with the goal of spreading best practices broadly. To learn more and get started using the playbook, visit bettercareplaybook.org.